Good morning, all of you. Today I'm going to teach you neurotic disorder, or especially we are talking about anxiety in neurotic disorder. Neurotic disorders are a group of disorder characterized by mainly by anxiety disorder, and somatoform disorders. Anxiety disorder are the most prevalent mental health problem today. There are panic disorders, phobic disorders, OCD, obsessive compulsive disorders, post traumatic stress disorder, generalized edema, and generalized anxiety disorders. If we are talking about etiology, then we can see biological neurotransmitter associated with anxiety disorder are norepinephrine, serotonin, or gamma aminobutyric acid, GABA. Genetic, there is a higher frequency in first degree relative of the affected patient. Psychological and behavioral, according to Freud, uh, anxiety is a signal to the ego that can unacceptable drive is pressing for conscious representation and drive. If we are talking about clinical features, then we can see panic disorder. The main feature is presence of unexpected recurrent panic attacks. A panic attack is characterized by a discrete period of intense fear that is accompanied by several somatic and cognitive symptoms such as palpitation, sweating, trembling, chest pain, feeling of choking, nausea, chills and hot flashes, fear of dying. If we can see in phobic disorder, what kind of clinical features we can see? These are characterized by arousal of several severe anxiety when the patient is exposed to a specific situation or object. The fear is usually marked and persistent. If we are talking about obsessive compulsive disorder, then obsession are recurrent thoughts, impulses, or feeling which the person try to resist. Compulsions are repetitive acts, example again and again hand washing, lock checking, and obsession increase a person's anxiety. Again and again hand washing, lock checking, and counting, and obsession increase a person's anxiety. If we are talking about post traumatic stress disorder, this develop a person who have experienced extreme traumatic stress. Such trauma include serious accident, rape, and witnessing an accidental death. The minimum duration of symptom is 1 month. Generalized anxiety disorder, this is characterized by anxiety which is excessive symptoms are palpitation, sweating, headache, irritability, and shortness of breath. If we are talking about the treatment of anxiety disorder, then we can give psychotherapy, behavior therapy, hypnotherapy, yoga and meditation. And if we are talking about what kind of pharmacotherapy we can use in anxiety disorder, then we can give these kind of medicine like alprazolam is very effective. A dose is 1 to 6 mg per day in panic disorders. Propranolol is very useful in social phobia and post-traumatic stress disorder. We can give imipramine, and compulsive disorder we can use clomipramine in 150 to 300 mg per day dose. If we are talking about generalized anxiety disorder, then we can use benzodiazepines. Thank you.